Implants for dental purposes are a common alternative to replace missing teeth. But are them effectively replace many missing teeth? In this clip, we'll look at the advantages and disadvantages of dental implants with regards to replacing several missing teeth. What are dental implants? Dental implants are synthetic tooth roots which are placed into the jawbone for support of a bridge or replacement tooth. Implants are composed out of titanium. It is a biocompatible material that bonds with jawbone via a process known as the osseointegration. This creates a solid and sturdy foundation for tooth replacement. Benefits of dental implants for multiple missing teeth. One of the primary benefits that dental implants offer is the fact that they can be used to replace missing teeth with no impact on the adjacent teeth. In contrast to bridges made of dental material, which depend on adjacent teeth to provide support, dental implants are self-supporting and do not require dental preparation other than healthy ones. The healthy teeth around the gap are left intact and in good health. Dental implants can be used as the long-term solution to missing teeth. When properly maintained, they are able to last for decades, which makes them an extremely durable and economical option for replacing several missing teeth. Furthermore, dental implants are designed to look and feel just like real teeth, allowing people to eat, speak, and smile in a confident manner. Limitations of dental implants for multiple missing teeth. Dental implants are an ideal option for patients who suffer from several missing teeth. They do have few limitations to take into consideration. One of them is the expense of dental implants. These is higher than alternative tooth replacement alternatives, including bridges and dentures. It is nevertheless essential to take into consideration the potential long-term advantages of implants for dental when looking at the price. Another drawback of using dental implants that replace missing teeth is that of the size of healthy jawbone needed for their placement. There are times when patients might not have sufficient bone mass in order to hold dental implants. In these cases, it is needed to increase the jawbone prior to placing implants. Finally, the process of healing for dental implants could last for several months, as the implants will require time to fuse with jawbone prior to the new teeth are able to be inserted. The process may involve multiple visits and a bit of patience on the part of the patient. Implants for dental purposes can be an efficient solution to replace several missing teeth. Implants have many advantages like separation from nearby teeth, long-term stability, and natural beauty. It is crucial to take into consideration the expense of the implant, its bone density, as well as recovery time for dental implants before you make an investment. If you're thinking about implanting dental implants to fix many missing teeth, you should consult an experienced